What is sandpaper rash of scarlet fever? In scarlet fever, the sandpaper rash is a key diagnostic symptom. It appears as a fine, red, raised rash that feels rough like sandpaper, typically starting on the neck and chest before spreading to other parts of the body. The rash is often accompanied by other symptoms like fever, sore throat, and strawberry tongue. Why scarlet fever cause sandpaper rash? Scarlet fever causes a sandpaper-like rash due to a toxin produced by the Streptococcus pyogenes bacteria. This toxin damages capillaries, leading to the characteristic red, bumpy rash that feels rough to the touch, like sandpaper. Let's discuss it in details. Characteristics of a scarlet fever rash. Appearance of rash. The rash is characterized by small, raised bumps that give the skin a rough, sandpaper-like texture. Color of rash. On white skin, the rash appears pink or red. On brown and black skin, it may be harder to see but can still be felt as a rough texture. Texture of rash. The rash feels rough, like sandpaper, and may be itchy. Distribution of rash. The rash often starts on the neck and chest, then spreads to the trunk, arms, and legs. It tends to be more prominent in skin folds like the armpits, elbows, and groin. Timing. The rash usually appears 12 to 48 hours after the onset of other symptoms, like fever and sore throat. Duration. The rash typically fades within a week, and skin peeling may occur as it clears, especially on the hands and feet. Other features of scarlet fever. A pale area around the mouth, known as circumoral pallor. It is a distinctive feature showing the pale area around the mouth, while the rest of the face may be flushed. And a strawberry tongue. Red, bumpy tongue are also common signs. Other symptoms. Besides the rash, scarlet fever is also characterized by fever, sore throat, headache, body aches, and a strawberry tongue. A red, swollen tongue with prominent bumps.